Hi everyone, welcome back to your channel. I love pharmacology, and today's session let us understand how bisphosphonates are important in maintenance of the bone health. So welcome to Endocrine Pharmacology. Myself Dr. Padmanabha TS, Faculty of Pharmacology. So we'll go through these overviews or under these headings. First, we'll go through what is bisphosphonates. Second, we'll go through what is the mechanism of action of bisphosphonates. Third, the classification of bisphosphonates. Fourth, the instructions which are given to a patient for oral administration of bisphosphonates. And what are the indications or uses of bisphosphonates and their respective adverse effects with respect to the oral bisphosphonates as well as the parenterally available bisphosphonates. Then we'll go for a summary. So we'll start with the bisphosphonates. So bisphosphonates are the analogs of pyrophosphate. So please remember they are the analogs of pyrophosphate where there will be replacement of oxygen. So the carbon atom replaces the oxygen. So carbon atom will replaces the oxygen in the POP skeletal. And the basic mechanism of action is to inhibit bone resorption. Very important. They have asked many times in your exams as well as in your NEET exams. So please remember it inhibits bone resorption. So it does not have a direct effect on the bone deposition. So the main action is to inhibit the bone resorption. That means indirectly it will going to inhibit which bone cells? It will going to inhibit the osteoclast. So please remember it will going to inhibit the osteoclast activity. So thereby when it prevents the bone resorption, so calcium will not be lost from the bone. Thereby it will be useful in the prevention of osteoporosis both in case of the males as well as the females, and also useful in case of metabolic bone disorders in conditions where they will be having hypercalcemia, etc. So please remember bisphosphonates are the most effective anti-resorptive drugs. So coming to the generation differences. So there are basically 3 generations of bisphosphonates based on the side chain as well as their potency. So first generation, they are non-nitrogenous compounds or they have non-nitrogenous side chains and they are least potent. Whereas the second generation and third generation, they have got the amino, or please remember it has got the nitrogenous ring substitution. So it is because of the nitrogenous ring substitution it is more potent in nature as well as it has got higher efficacy, and they have got additional mode of actions such as inhibiting the mavacamate pathway as well as it has got the anti-tumor activities. So moving on to the classification under first generation of bisphosphonates, they are the non-nitrogenous compounds. Example is etodronate and telodronate. Whereas the second generation bisphosphonates, you have got palmidronate, alendronate and the ibandronate. Whereas the third generation, which is more efficacious as well as more potent, we have examples such as residronate as well as the zolendronate. So please remember this palmidronate is given through IV and zolendronate is given through IV, whereas rest all is given through oral route. So please remember rest all will be given through oral route, whereas palmidronate and zolendronate is given through IV route. Again, this is the very important MCQ question. So under this, more efficacious drug will be the zolendronate. It is the more potent as well as it is more efficacious. efficacious, more efficacious. Very, very important. So the least potent will be this one, least potent will be the first generation bisphosphonates. So next, moving on to the mechanism of action of bisphosphonates. So please remember, the bisphosphonates have got strong affinity towards the calcium phosphate, and also they have got selectivity towards the calcified tissue. So before going to that, we'll understand what are the two important components of the bone. So we have protein matrix and the solid mineral phase, that is the hydroxyapatite. So basically bisphosphonates have got high affinity towards the hydroxyapatite. So let us draw a diagram here. So if you consider this as the protein matrix, and this is your mineral phase, and this is your osteoclast. So when the osteoclast comes and binds to the surface of the resorptive surface, so this will be the resorptive surface, So whenever it binds to the resorptive surface, so it creates the acidic pH or the acidic medium, where this acidic medium will going to increase the release of calcium. And also remember that since bisphosphonates have got high affinity towards the hydroxyapatite, so along with the release of the calcium, there will be release of the bisphosphonates also. So there will be release of two things. One is the calcium as well as the bisphosphonates. And this bisphosphonates will going to enter into the osteoclast, and this will going to lead to what it is called as apoptosis. That is the program death. And also along with that, it will also going to suppress the activity of interleukin 6. So this is how the bisphosphonates will going to produce its mechanism of action. So there are resorptive pits. So these are the resorptive pits. So on the resorptive pits, what will happen? First is the mineral phase is solubilized. So this is the mineral phase solubilized by the acidic pH. Acidic zone is created by the osteoclast. So followed by, there will be resorption of the protein also. So once it starts resorbing, it enters into the protein matrix layer. So there will be resorption of protein matrix in this area by the acid hydrolases, which are secreted again by the osteoclast. So osteoclast first will going to attack the mineral phase, and due to the acidic zone created, it will going to release the calcium. As we know that bisphosphonates are tightly bound to the hydroxyapatite, so bisphosphonates will also get released along with the calcium in the acidic environment, leading to the entry of the bisphosphonate through endocytosis into the osteoclast, leading to the apoptosis as well as the interleukin 6 suppression. So thereby it decreases the osteoclast activity. So please remember, it has got high affinity towards the calcium phosphate, mainly the hydroxyapatite that is present in the mineral phase, and they get released in the acidic zone, and basically it will going to inhibit the resorption. So coming to the basic mechanism in the form of flow charts. So bisphosphonates have got high affinity. They will bind to the hydroxyapatite. They bind to the calcium ions, and in the acidic zone, they get localized in the acidic zone under the osteoclast. And what will happen is next is, whenever the acidic zone created by the osteoclast will lead to the release of calcium ions from the bony surface. This will create the high acidity, and along with that there will be release of bisphosphonates, also release of bisphosphonates, and this will going to get internalized or endocytosized into the osteoclast. Thereby it causes accelerated apoptosis, very important, accelerated apoptosis, and there will be disruption of the cytoskeletal as well as the ruffled border of the osteoclast will be disturbed. And it also affects the osteoclast precursor and also inhibits the differentiation by suppressing the interleukin 6. So the important key points to remember is bisphosphonates will be concentrated or will be bound to the mineral phase of the bone and under the osteoclast in the acidic zone. Whenever the calcium gets released, bisphosphonates will also be released and it will going to enter into the osteoclast, leading to the apoptosis and the cell death. Apart from that, the second mechanism which has shown by the second and third generation because of their nitrogenous side chains or nitrogenous substitution. So they have got important metabolic effect on the mevalonate pathway, that is the lipid synthesis pathway. So it will going to inhibit the prenylation process of certain GTP binding protein which are involved in the cytoskeletal organization of the osteoclast, as well as the membrane ruffling of the osteoclast, as well as the vesicle movement and the fusion of the osteoclast. So basically by inhibiting the prenylation process of certain GTP binding protein involved with respect to the cytoskeletal organization of the osteoclast and the membrane ruffling of the osteoclast as well as vesicle movement, it will going to inhibit the osteoclastic activity. So the net result will be there will be inactivation of the osteoclides and there will be impaired vesicle fusion, and also there will be enhanced apoptosis because of the mevalonate pathway inhibition. So because of the interference with the mevalonate pathway, they also has got the anti-tumor activity, very important anti-tumor activity on the bony metastasis, especially in case of the breast cancers. So please remember the second mechanism is to inhibit the prenylation process, thereby it inactivates osteoclast, causes apoptosis as well as impairment in the vesicle fusion. So thereby it decreases the resorption. So that's why they are called as anti-resorptive property, and it has got anti-tumor activity as well. So coming to the pharmacokinetic parameter, which is very important. So whenever we use bisphosphonates, it can be given in the form of two routes. One is the oral route and another is the IV route. Whenever it is given through oral route, the most common side effects or limiting factor towards use of oral bisphosphonates is it causes the esophageal irritation. And through IV route, when it is given, it causes most commonly thrombophlebitis. And also there will be pain. So oral bisphosphonates are poorly absorbed. So most of the oral bisphosphonates have got oral bioavailability of almost 1%, and whenever it is administered orally, which are the drugs which can be administered orally, that is the first generation alendronate, as well as the second generation you have got the ibandronate, resodronate, or the third generation. So whereas through IV infusion we give only two drugs, that is palmidronate and the zolondronate. Very important, you should remember. Apart from that, when we use the IV infusion, what are the advantages of the parenteral administration of bisphosphonates? The frequency of dosing can be reduced, thereby it will lessen the drug administration once a year. So frequency of dose administration is reduced. So thereby these drugs can be given once a month or once a year, and there will be only 50% of the absorbed or injected drug is sequestrated in the bone. So since there will be lesser drug which get deposited in the bone through the oral route, we prefer IV infusion. So remaining 50% will be getting excreted unchanged through the urine. So what will the major side effect when it is given through oral route? Major limitation factor is the gastric irritation, esophagitis, and it can cause retrosternal pain. It can cause retrosternal pain. So which are the condition where oral bisphosphonates are contraindicated? So they are contraindicated in conditions or patients suffering from gastroesophageal reflux disorders, peptic ulcer, as well as the renal impairment. So that is why whenever it is asked to take oral bisphosphonate, you need to ask to prevent it. What you want to tell is, we need to ask the patient to sit in a upright position when taking the tablets for at least how many minutes? At least 30 minutes. So this, by following this instruction, they can avoid the gastric irritation or esophageal irritation. So it has to be taken in empty stomach. Basically it has to be taken in empty stomach. And one more thing you need to tell is with a full glass of water. So very important thing to remember from this slide is IV infusion. We give only 2 drugs, that is palmitronate and zoledronate, and the major toxicity associated with oral bisphosphonates is gastric irritation and esophagitis. So coming to the therapeutic indications of the bisphosphonates. So they are mainly useful in conditions which are associated with enhanced bone turnover. So there are 4 important therapeutic indications. One is the osteoporosis. So there are 4 important indications. One is the osteoporosis. Second one is the Paget's disease. Third one is the hypercalcemia of malignancy. And fourth one is the osteoclastic bone metastasis. But remember, in osteoporosis, you can give it in case of postmenopausal individuals. As well as in case of both males and the females, elderly males and the females, and also in case of the steroid induced osteoporosis. So Paget's disease is an abnormality in the bone where there will be destruction of the bony architecture. So hypercalcemia of malignancy is an emergency condition which you need to treat very strictly, as well as urgent measures should be taken. So osteolytic bone metastases are associated with the carcinomas. So let us see one by one. So osteoporosis, basically bisphosphonates are used to prevent and treat the osteoporosis in case of the postmenopausal osteoporosis in women, age-related osteoporosis, idiopathic osteoporosis, and steroid-induced osteoporosis. So basically in case of osteoporosis, the bisphosphonates will going to conserve the bone mineral density, that is BMD, and also reduce the risk of fractures such as the vertebral fracture as well as the hip fracture. And please remember, bisphosphonates will have an anti-resorptive effect. So please remember, bisphosphonates have got anti-resorptive action, and they do not directly stimulate the bone formation. This is very important. So the main action of the bisphosphonates is through preventing the resorption induced by the osteoclast. But please remember, they do not have a direct stimulation on the bone formation. And what are the other drugs which can be used? The most effective drug will be the bisphosphonates. The most preferred first choice drug in osteoporosis is the bisphosphonates. Other drugs that can be used as a supplemental drug in the osteoporosis is the hormone replacement therapy, raloxifene, which is a selective estrogen receptor modulator. This is the selective estrogen receptor modulator and the estrogen replacement. And please remember, the bisphosphonates are the first choice of drug in treatment of osteoporosis, which will afford a benefit at least for 10 years. So it can produce the affordable benefits at least 5 years of the continuous usage. And one more thing you should remember, very important, is the duration of the actions of the alendronate. The T-off of the alendronate, even though it is stopped after 5 years, it will remain till 10 years. It will remain till 10 years. So treatment behind the 5 years is not necessary, but their effects, once you stop at the end of 5 years, they will remain up to 10 years. That the example is the alendronate. They get deposited in the bone. So coming to the second use, that is Paget's disease, which is a abnormal osteoclast function, where there will be disordered bone remodeling, and there will be honeycomb like bony architecture. So how it can be treated? So basically in Paget's disease, the bisphosphonates will going to arrest the osteolytic lesion that reduces the pain, and the symptomatic relief will be provided. So when compared to the calcitonin, which is a hypocalcemic hormone, which inhibits the parathyroid hormone activity, it is cheaper than the calcitonin. When combined with the calcitonin, it further gives the beneficial response. So bisphosphonates should not be exceed more than 6 months, and the course can be repeated after the 6 months. So coming to the third use, that is the hypercalcemia of malignancy, which is a severe form of hypercalcemia, which is a medical emergency which is associated with the dehydration as well as the altered consciousness. So how to treat it? Very important, the emergency condition. So rehydration is very important, rapid rehydration with the IV saline infusion, which will going to lower the calcium levels. Along with that, you need to give a palmitoronate and zoledronate, that is the parenteral bisphosphonates, through IV route. So although it is given, so it may take up to 24 to 48 hours to act. So what will be the best, fastest acting drug? So to reduce the serum calcium level within few hours, what you need to do is you need to give a supplemental IM calcitonin, which acts within 6 to 12 hours, and which has got the very rapid action. Following that, what will happen? It's a hypocalcemic hormone. So vigorous hydration has to be done, and also give the once you replenish the volume along with the calcium has to be excreted out of the body. So it can be done by the furosemide, which is a loop diuretic or a brisk diuretic, high ceiling diuretic. So it will going to enhance the calcium excretion and prevents the volume overload. So this can be followed by administration of the bisphosphonates like parenteral bisphosphonates. So please remember, in this condition, hypercalcemia of malignancy, the role of the oral bisphosphonates are not as good as that of the IV bisphosphonates. So oral bisphosphonates are not useful, and corticosteroids are also not useful. Even though the corticosteroids reduces the plasma calcium levels, their action will develop only after 1 to 2 weeks. Very important. These two slides are very, very important. So you give calcitonin to achieve a rapid action. So next we will have a last condition, that is osteolytic bone metastasis. So osteolytic bone metastasis, we use a parenteral drugs such as palmitoronate and the zoledronate. Basically, it will also have a similar effect that of the Paget's disease, where they are going to arrest the osteolytic lesions, reduces the bone pain. And zoledronate has got one more important activity, that is it has got the anti-tumor property. So it has got an adjacent role as an add-on drug in reducing the breast carcinoma recurrence, as well as it will delay the skeletal abnormality in women with the bony metastasis. So what are the instructions you like to give whenever the bisphosphonates are administered orally? So you need to ask the patient to take the oral bisphosphonates in an empty stomach in the morning with a full glass of water, and he should not lie, and it should be he or she should sit in a upright position for at least 30 minutes. Upright position for minimum of 30 minutes, and they should not consume any food in that in that 30 minutes. So at least for 30 minutes, you should sit in upright position without having any food. So what will happen if they lie down? There will be irritation of gastric mucosa as well as esophageal mucosa, which can increase the risk of esophagitis as well as peptic ulcer. So thereby you can prevent the drug with esophageal mucosa, contact of drug with esophageal mucosa, which can result in the esophagitis, erosion and the ulcers. So basically, what are the things which can interfere with the oral bisphosphonates? So if it is given along with the chelating agents such as calcium, iron, antacid, mineral water, tea, coffee, fruit juice, it will going to form a metal salts, and they will be forming a non-absorbable complex with the bisphosphonates. So one of the very important drug interaction you should remember is whenever you give a bisphosphonates with the NSAIDs, non-steroidal anti-inflammatory drug, the risk of there will be aggravation in the gastric irritation. So as you know that NSAIDs will going to increase the gastric irritation caused by bisphosphonates. So coming to the etodronate in general, etodronate is the first bisphosphonates which will be used clinically, and it was given orally for treating hypercalcemia, Paget's disease and the hypertrophic ossification, which will occur in the skeletal muscles and the soft tissues. So basically it interferes with the bone mineralization, and very important thing is continuous therapy can produce osteomalacia, and their use has been reduced nowadays. The clinical use of etodronate is very less nowadays. So coming to the palmidronate, which is given through a parenteral route, that is IV infusion, which is second generation bisphosphonates. So it is given through IV infusion weekly or monthly, and they are used in the Paget's disease, hypercalcemia malignancy, bony metastasis, and in adverse effects will be your thrombophlebitis. Since it is given through IV infusion, it can cause thrombophlebitis of the vein, bony pain, fever as well as leukopenia, and also they can be associated with flu-like reactions due to the release of cytokines in the initial part. Initially there can be release of cytokine that can lead to flu-like reactions. So very important thing you should remember from palmidronate is it is given only through IV infusion. It is given through weekly or monthly, as well as adverse effects. Mainly it is related with the IV infusion such as thrombophlebitis, bony pain, fever, leukopenia. Coming to the alendronate, which is again a second generation bisphosphonates, very potent. It is given orally. So basically used for prevention and treatment of osteoporosis in case of both males and females, Paget's disease, etc. So adverse effects will be since it is given through oral route, it can cause esophagitis, gastric erosion, retrosternal pain, flatulence, headache, body ache, and initially there can be reduction in the calcium levels. So it is mainly given through weekly. So oral bioavailability of such drugs are very low. So it is of approximately 1%, and up to 50% of the drug will get sequestered into the bone, and rest of them will be excreted unchanged in the kidney. So because it gets sequestrated in the bone, the terminal T-off of alendronate is around 10 years. So even after stoppage of alendronate after 5 years, so it has to be stopped after 5 years because there is no extended benefit after 5 years. So since it gets sequestrated into the bony tissues, what will happen is the alendronate effect will remain for 10 years. So there needs to be dose reduction with respect to alendronate in case of renal impaired individuals. Coming to the ibandronate, again ibandronate will be the second generation bisphosphonates. It is used to reduce the risk of vertebral fractures, but remember they are not useful in the non-vertebral fractures. So use in case of Paget's disease through IV infusion, hypercalcemia of malignancy, and it is given monthly, once a month or daily, depending upon the patient condition. So please remember, ibandronate or bisphosphonates in general, they are useful in the treatment of vertebral fractures to reduce the risk of vertebral fracture, not the non-vertebral fractures, and they are given monthly. So coming to the residronate is the third generation bisphosphonates, residronate. So it is given orally. Please remember, it is given orally, not the IV. IV is only the palmidronate and the in the zoledronate. So it is more potent than the alendronate, but equally efficacious. Again, the oral bioavailability is very poor, and they are used in the treatment of osteoporosis, Paget's disease, etc. They can be given daily or weekly as well as once a month, and it has to be taken orally morning with a full glass of water to prevent the esophagitis. Coming to the last and very important drug, you can say it is a drug of choice, zoledronate. So it is a parenteral drug, highly potent, highly efficacious, third generation bisphosphonates. They are used for hypercalcemia because of their more effectiveness, faster acting than the palmidronate, as well as it is a drug of choice now. And it has to be infused over 15 minutes compared to the palmidronate, which may take around 2 to 4 hours. Infusion is applicable for 15 minutes because the reason is they are less irritable to the veins, very important. And uses will be the conditions associated with hypercalcemia, bony metastasis, osteolytic lesions, that is Paget's disease, etc. And what are the actions which are very important so that zoledronate can be used in such conditions? So osteoclastic activity will be markedly suppressed or decreased. They have additional anti-tumor effect. They interfere with the lipid synthesis. They arrest the proliferation of bony metastasis in case of the prostate as well as breast carcinoma, and also in case of multiple myeloma cells. So what will be the adverse effects of zoledronate? So please remember, it can produce flu-like symptoms because of the initial rise in the cytokine levels through IV infusion, and can be associated nausea, vomiting, body ache and pain. And very important thing is they are associated with renal toxicity, as well as rarely at very high dose of IV infusion it can cause necrosis of the jaw. Very important, necrosis of the jaw. So this has to be given through IV infusion once every 12 months for a maximum of 5 years. Very important. So it is once a year and maximum of 5 years. So use is in case of osteoporosis, in case of postmenopausal women who are not tolerating the alendronate and the risedronate orally. And whenever giving the zoledronate, you need to dilute with the saline as well as the glucose solution, and it should be infused over a period of 15 minutes because of the advantage is they are less irritable to the vein, and they can be repeated after 7 days, then at an interval of 3 to 4 weeks. But the standard dose will be once every 12 months and maximum for 5 years. So coming to the summary, what are bisphosphonates? Bisphosphonates are the bone stabilizing agent. Basically, they will going to act as a anti-resorptive drug. So what is the mechanism of action? They have got two mechanism of action. So basically it will going to inhibit the osteoclast activity, and also they are going to inhibit the lipid synthesis pathway, that is mevalonate pathway, by inhibiting the prenylation. Thereby it also inhibit the osteoclastic activity. And third important action is it has got anti-tumor activity. Please remember, these are the three main mechanism action of the bisphosphonates. And classification, you have got the first generation, second generation and third generation. So usually the first generation is less potent, and the second and third generation are more potent because of their nitrogenous compounds. And here also you can remember, only drugs which are given through IV infusion is your palmidronate and PZ, zoledronate, PZ. Rest are given through oral route. So what are the instructions you will give whenever you are administering the oral bisphosphonates? So patient has to sit in a upright position for 30 minutes, and the tablet has to be taken orally in the morning along with the full glass of water, and they should not consume any food during that 30 minutes. And what are the uses? They are used in 4 conditions. One is in case of the osteoporosis, in case of Paget's disease, in case of hypercalcemia of malignancies, and in case of osteolytic bones in case of malignancy or carcinomas. So basically it is used for osteoporosis in case of postmenopausal individuals, age related, in case of both males and females, and also in case of steroid induced. So in all those things, the drug of choice will be your bisphosphonates. What will be the adjunct drug? Adjunct drug will be your hormone replacement therapy, is your estrogen and your raloxifene, which is a selective serotonin, which is a selective estrogen receptor modulator. So what will be the adverse effects when you take it through oral route? Mainly it causes esophagitis or esophageal irritation. Through IV route, when it is given, it will cause thrombophlebitis. And one more important thing you should remember is alendronate. All this bisphosphonates will end with dronate, and alendronate has got speciality of T of around 10.5 years. So zolendronate has got very important property, that has got anti-tumor property, and it has to be given a maximum of how long? 5 years, and every once in 12 months. So this you need to keep in mind. And whenever you are giving through oral bisphosphonates, you should avoid using with the chelating agents. So avoid use of bisphosphonates with chelating agents like iron, calcium, etc. Antacids, etc. So this was about the class on the bisphosphonates. So hope all of you would have understood the importance of bisphosphonates and how it will going to ask. So in your exams, please remember this. This is the one important topic that can be asked for 3 marks, short essay questions, or directly they can ask for MCQs. Which is the drug of choice for osteoporosis? It is your bisphosphonates. So which are the drugs which are given through IV route? That is the palmitoronate and the zolendronate. So which is the drug which has got the half-life of more than 10.5 years? It is the alendronate. So which drug has got the anti-tumor property? It is got zolendronate, along with the inhibiting osteoclastic activity and inhibiting lipid synthesis. They also have anti-tumor activity. So what are the instructions you going to give whenever it is given through oral route? Patient has to sit in upright position for at least 30 minutes after the intake of water in the morning with a full glass of water. So IV route, it causes thrombophlebitis as well as it can cause cytokine induced flu-like reactions. Thank you. So if you find this video useful, please do subscribe to my channel I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.